So, in my ulcerative colitis slash Crohn's journey over the past 9+ years, I have been to multiple hospitals, multiple GI doctors. We moved from Jacksonville, Florida to New Jersey. We were in New York. We were in Montana. And then we were in Alabama for a year and then back to Jacksonville, Florida. One of the reasons we moved back to Jacksonville, Florida was for my health care. When we were in Montana, I had a wonderful GI doctor. And he was probably one of the best GIs in the state. He was in Billings, Montana. And I really liked him. I liked the ideas that he brought to my treatment. I liked the care that I was given, but he still was limited, and he expressed his frustration with me, as I'd been a patient for a while, as to what he could do and the limitations that he had working even at a hospital like that. And he wound up moving to another state. And as a result of that, we kind of evaluated my medical condition and what was happening and what we were doing at the time. And we decided to move back to Jacksonville, Florida. And I was being taken care of by a doctor who was at Baptist, which is a fairly large hospital here in Jacksonville, Florida. At the time, that doctor wound up moving from Baptist to St. Vincent's, which I made that move with my GI doctor and getting about as much care as I possibly could. And then at some point, my GI doctor, and I'm very grateful that they did this, recommended and was able to get me into Mayo Clinic here in Jacksonville, Florida. And so part of that was that my GI doctor understood what the limitations of the care that could be provided, even in the institution that I was at, which was a fairly large hospital. Before that, I had been to a lot of GI doctors. In fact, I remember one doctor I was talking to and had visited, and I was at this a bit. I had been at Borland Groover Clinic, I had been at Baptist, and this was a GI doctor who kind of had his own practice. And I was talking to him, and at that time I was on Remicade and had been to Borland Groover, and Remicade really was no longer working for me. And so I was talking to this GI doctor, and I had mentioned, hey, I've been doing some research, and I would like to be on Stelara. This is kind of what I'd researched. And what was kind of blew my mind was that this doctor opened up his phone and was Googling Stelara. He didn't know what it was. And granted, at this time, Stelara was rather new, but I was flabbergasted that I knew more about some of the medications that were being released and that were available to the public, this is before the commercials and everything were out for it, than he did. And I thought, if he's a GI doctor and this is his specialty, he should know more than me. And so that was my last visit with him. And what's interesting is through my course of care, having Crohn's colitis Crohn's, that diagnosis kind of changed over time, off and on, was that I changed doctors frequently, every year or so, as I would do research and then understand, obviously we moved a little bit, so that was part of it, but also I would do research and understand that the level of care that I was getting wasn't the best, that there was a better level of care, whether I was on Facebook groups talking to people or talking to other people who had the disease, talking to people who were at Mayo Clinic or at Cleveland Clinic or the other things, and what kind of treatments they were getting and what was happening. I just kept leveling up doctors. And what's fascinating to me, and this is just my experience, right? Other people may have a different experience, is that here in Jacksonville, there's something called the Borland Groover Clinic. And Borland Groover kind of specializes in GI care. I got some of my worst care from Borland Groover. I really felt like the people that I was dealing with there didn't fully understand what was happening, didn't fully understand what was going on, and they were just writing prescriptions, going in, doing infusions, but not fully understanding, are the infusions working and what's happening? And then once I got to Mayo Clinic, they have just a vastly different philosophy. And I remember one of my first visits, the GI doctor at Mayo said, how are you doing? However, and how do you feel? However, how you feel and how you're doing is less important to me than the science and the numbers. We do everything by science and numbers, and just taught me, what blood tests meant what, and allowed my questions, and just really being scientifically driven with the care. And I loved that because for my Crohn's colitis, I had all kinds of symptoms, but pain was never one of them. I was never in pain. And that happens with some patients. Some patients just don't have pain as a result. And the GI at Mayo, and what Mayo understands very well, is that with IBD and with Crohn's colitis, the patient may not know and may not be able to tell with symptoms what their condition is, or how sick they are, or how well they are. And that's definitely the case with me. I have been in a flare-up and not known it. And I've learned over time and through talking with them how to detect that. And that's one of the reasons why every month I have my blood, no matter how I feel and how great I'm doing, I have blood work done so that we can look at the numbers and see what's going on. But that's all, just part of it. And something that I talk to people about as I'm in these groups and talking to people who have Crohn's and colitis, et cetera. What are your numbers? What do they look like? What questions is your GI asking you? What is the level of care you're getting, and what is the methodology of treatment? How do they know what drug to put you on? What's the driving that decision-making process? And some of these doctors, it's just my experience, are being paid by the pharmaceutical companies. And I don't think there's anything wrong with that. As long as the doctor fully understands what is the best treatment for my patient. Some of the GI doctors that I have been to won't prescribe certain drugs, even though they would be a better drug for me, because they didn't get the kickbacks from those drugs. That's just personal experience. That 100% happened. And so I would just move to a different doctor who I could get a better level of care from. So what I have noticed, and I've talked recently over the past month with my providers at Mayo Clinic about this, is that why, when I first was diagnosed, they said it was ulcerative colitis, and said it was ulcerative colitis for a while, and then started using the term Crohn's. And I understand that some of that had to do with an insurance play, right? Sometimes insurance will approve a medication for one, but not approve a medication for another. And depending on what tests you run, those tests can come back Crohn's disease. Those tests can come back ulcerative colitis, and they can send whichever test they want to whichever billing department and get you on the drugs that they need to get you on. That's just how the game is played. It depends on whether you're running a pathology, depends on whether you're running a blood test. You can kind of get that. And what I've learned and what they have explained to me is that they're now using the term Crohn's colitis because it's a spectrum. And you can fall kind of anywhere on that spectrum, but it is essentially the same disease. I didn't know that. I thought they were two vastly different things. And the reason I thought they were different things is because there are so many treatments that are available for one or the other, one or not the other. If you have one, then you can have a reversal of your ileostomy. There are different medical procedures that you can have. There are different drugs that you can be on, different clinical trials depending on which one you have. And I think what's happening is very recently, that concept is starting to change, and they're starting to see it as a spectrum. It's also interesting to note that depending on the medication and how old the medication that you're on is, when they understood them or thought of them as two kind of distinctly different things, Crohn's versus ulcerative colitis, the medication may have gotten approval for one, gone through clinical trials and gotten FDA approval for one and not the other. So some of these drugs are not FDA approved for both Crohn's and colitis. And that has a little bit to do with when that FDA approval happened. I just find this all fascinating and interesting, and just kind of goes to show that if your GI isn't up to speed and isn't aware of all these things, there may be treatments that you can get, because a lot is happening very quickly, very recently, as medications are coming to market. And if your GI doesn't know this and doesn't have access to this information, there could be care that you could receive that you're not receiving. And so as I talk to people, obviously, listen to your doctor first, right? Above, like me, some guy on the internet. But also listen to your gut. Like, is what my GI is telling me true? And kind of where am I located? Is this GI at an institution? I highly recommend people that are near surgery or they're very sick, and not doing well. Like, you owe it to yourself to make a trip, go to Cleveland Clinic or go to a Mayo Clinic and go to an institution that has a lot of experience with this, and just make sure that what you've been told is correct. It's really, really worth it to get that second opinion, to make sure that the information that you've been given is right and accurate, because from my personal experience, so many times it was just wrong. It wasn't correct. And the treatments that I was given, the care that I was given, the doctor saying, we've done everything to do. I remember I was in the hospital, this was 6-7 years ago, saying there's nothing more that we can do, you have to have surgery. And I went on for another 6 years before needing to do the ileostomy surgery. There were medications that he just didn't know about. And there were treatments that he didn't know about that worked for me. Full remission for another 6 years and living a great life. Now, I'm not saying having the ileostomy is bad or that I regret having it at all. Absolutely not. It's transformed my life, and I absolutely love the ileostomy. But what I'm saying is, how many people are talking to GI doctors and in the hospital and talking to surgeons that just don't have all the information, that just don't know everything. And so you owe it to yourself. Like, go somewhere, especially if you're not in a city or in a location that has a great GI group. Go somewhere and get some, and talk to them and just see, what can happen. Because in my experience, a lot of my care and a lot of my doctors, they didn't know everything. And I'm so grateful to be at Mayo Clinic, and just getting wonderful, wonderful care and treatment from the doctors there. And so that's kind of my encouragement, and also just understanding that things are happening rapidly and things are happening quickly in this space, and you need to be around someone who is understanding, who is in the know, and who is really on top of what care can be given. All right. Look, this thing's looking great, huh?